Low back pain prevention. We will now discuss low back injury, what causes it, what to do about it, and how to prevent it. Low back injury is the number one workplace injury. 80% of all adults will sometime experience a bout of low back pain. In fact, we spend more money treating low back pain in the United States than we spend treating cancer. Your spine is a hard-working and sensitive structure that can be vulnerable to sprains and overloading. The spine is saturated with lots of very sensitive nerves that help us balance upright on 2 feet. That makes low back pain a common risk for us all. That hard work in the presence of very sensitive nerves means a relatively small injury can cause major amounts of pain. The amount of pain rarely matches the amount of damage from an injury. This much injury can cause this much pain. There is a lot of brain activity involved in using your spine. Pain coming from the spine can have a big effect on the brain, causing fear and worry and stress, which will make pain worse. Almost every case of low back pain will get better, unless you freak out over it. So let me remind you, this program teaches you how to prevent low back pain. We cannot teach you how to treat a back injury because every injury requires an evaluation to identify what you need as an individual. So if you already have a low back injury, you need to consult a good medical provider who understands the most current research on low back pain, such as a doctor of physical therapy. The problem is many of us carry some misconceptions about low back pain, some wrong assumptions that have been around for decades. For instance, your spine is delicate, weak, and vulnerable to injury. That is a misconception that we consider wrong. Another one, once you hurt your back, it will never be right again, that you are now disabled. That also is usually quite wrong. When injured, you should totally rest your now disabled back. That also is wrong. And the big lie is an MRI will tell you exactly what is wrong with your back. That, these days, we consider to be quite wrong. It turns out that MRIs can actually lie to you. An MRI can actually make disability and pain much worse. If we take 1,000 adults with no low back pain and do an MRI, we will see herniated discs, bulging discs, degenerated discs, and degenerative arthritis in 65% of these people. These are people with no low back pain. So if you have low back pain and an MRI shows a herniated disc, you cannot assume that is the source of your low back pain. But many people will see that report on their MRI findings and assume that they are now permanently disabled, when most are not. Then there is the mighty aging process. The soft tissues of your musculoskeletal system include muscles, ligaments, tendons, joint cartilage, and discs in your spine. These tissues are all about 80% water when you're 20 years old. That water is what makes these tissues elastic, allowing them to take on a big load and then spring right back again. But as time goes by, these tissues lose much of that water, up to half or more. That makes them weaker and brittle, allowing damage to occur with even smaller loads. In your spine, the discs cushion and create space for movement between the vertebrae. These discs can thin and lose water and become vulnerable to damage from everyday loading. This thinning of the disc also causes the joints next to the disc to take on more load as the vertebrae settle closer together. This can cause these joints to become stiff. Some call this degenerative joint disease or osteoarthritis, but it is actually normal aging and does not usually cause pain unless you overload them. The muscles of the spine can become tight, losing their elasticity, allowing a greater risk of muscle strain. But the good news, this is all reversible. Maybe not 100%, but a small improvement in flexibility and strength can reverse a lot of pain and disability. Being more active and less afraid of your back is the key. That doesn't mean to go out and do anything stupid, but it means do not be inactive out of fear and worry. The key to keeping your back healthy And active is to become an expert on how your spine is put together mechanically, how it works mechanically, and how it breaks down mechanically. That leads you to learn what you must do to keep it working. It is just like taking care of your automobile. Why you have to change the oil, why you have to rotate the tires, why you have to replace the brake pads. The vertebra bones are attached at facet joints, cushioned by discs, strapped together with ligaments, moved and stabilized by muscles. The facet joints are small blades of bone that the vertebra pivot on. They have a rather small surface area, so there can be lots of pounds per square inch pressing on them. And they are filled with very sensitive nerve endings that sense posture and movement. That means a relatively minor sprain to these joints can hurt a lot due to all that nerve sensitivity. Over the years, these joints can actually become bigger, trying to increase their surface area. This is a normal aging change. They increase the size of the joints, trying to decrease the pounds per square inch. Some people call that degenerative joint disease or osteoarthritis. But this is misleading because most people with these age changes do not have pain. It is normal aging. So what work activity can stress these facet joints? That would include prolonged standing, especially on cement, steel, or vibrating surface, lifting a load above chest level, and any overhead work. Twisting can also stress these joints. An example would be backing up a forklift. The disc is a wafer of tissue sitting between the front 2/3 of the vertebra bones. It is a ring of gristle, very similar to the gristle that makes up your kneecap tendon. Sitting within that ring is a gob of mushy, wet, mucus-like jelly that we call the nucleus of the disc. The disc acts like a balloon for the vertebra to pivot on during bending forward or backward. In the normal upright posture, there is a degree of sway back to your lower back. This allows the body weight and whatever you may be lifting to be shared between the facet joints on the back of the spine and the back wall of the disc in the middle of the spine. This keeps the jelly in the nucleus pushed toward the front of the disc where it belongs. But when you bend forward or when you sit, the spine flexes forward, moving the body weight and whatever you may be lifting to load onto the front of the disc. It is suspected that this pushes the jelly of the nucleus backward toward the back wall of the disc. This back wall is much weaker than the front wall of the disc, and it can bulge backward from the force of the jelly. This becomes a bulging disc, and it generally does not cause pain unless it bulges enough to push on nearby sensitive nerve structures. That can cause sciatica pain that can run from your low back down your leg. If it pushes on the back wall hard enough, it can break through that wall. This becomes a herniated disc. And even this does not usually cause pain unless it hangs up on nerves or blood vessels located back there. Here is an MRI of a herniated disc, where the disc material is pushed backward against the nerves, causing sciatica pain. This would be picture A. Many people wrongly assume that this would require surgery. That is wrong. Most of these herniations will be absorbed by the body and allow recovery, as seen in picture B, taken 6 months after the first picture. That is why we now see far fewer back surgeries. A few will need surgery, but most do not. The primary workplace risk factors for disc problems include forward bending and prolonged sitting, which is actually a form of forward bending. The good news is this is highly reversible with a simple standing backward bend stretch. Simply stand, place your hands on your upper buttocks, push your gut forward to stretch the low back backwards gently. It is best that you keep your chin down rather than tip your head backward. Do this hourly or more if you're doing a lot of forward bending or prolonged sitting. This stretch is thought to push the jelly of the nucleus toward the front of the disc, where it is less likely to bulge. It may also increase the water content of the disc, which is important in reversing the aging changes that can lead to a degenerated or thinned disc. Discs are vulnerable to the aging process. The all-day, everyday weight bearing on the disc gradually squeezes out its water. The disc can go from its normal 80% water to about half of that over time. This allows the vertebra to sit closer together, increasing the weight-bearing load on the nearby facet joints. These joints become overloaded and stiff. The reduced mobility of these joints causes more loss of water in the disc. This is degeneration of the disc. We can reverse much of that with simple exercises and physical activity. Your physical therapist can advise you on what exercises and activity would fit your situation. We used to assume that humans have weak back muscles. It turns out they are not weak. They are, in fact, some of the strongest muscles in the human body. Their job is to actively hold a load off of the disc, off of the joints, and off of the ligaments of the spine, especially during lifting. The so-called rules of proper lifting are a moving target, changing quite a bit with ongoing research. But the best current advice is to use these powerful back muscles to not only lift the load, but to hold that load off of the vulnerable structures of the lower back that may be injured during overloading. So, to activate these protective back muscles, you should bend your knees to get close to the load and minimize any forward bending at the lower back. You tuck your chin in and push your chest out so that you create a slight arch to your lower back to preserve its natural sway back curve as you squat down to the load. Hold this stabilized position as you lift the load. What many people miss with this is that you should hold this position when you put the load down. Many people will lift correctly but put the load down incorrectly. So maintain this chin tucked, slightly arched position as you put the load down, bending your knees. It is also important to pre-position your feet to minimize twisting with that load. So if you plan to move the load to your right, you should turn your right foot outward to minimize the twisting that would otherwise occur at the knee under a load. We will discuss knee risks in a later learning segment. Those powerful protective back muscles can handle very large loads. However, these muscles shut down completely when you bend over more than halfway, about 45 degrees of forward bending. Bending like this shuts off the muscle protection to the discs, ligaments, and even to the muscles themselves. So we may recommend raising work tasks that would otherwise require you to bend over too far. This reduces risks to your disc, ligaments, and back muscles. Poor flexibility increases your injury risks. For instance, when you bend over, about half of that bending occurs at your lower back, while the other half occurs at the hips. This gentleman has excellent flexibility at his hamstrings, the muscles that run from the back of the thighs up into the buttocks. This flexibility allows much of the bending to occur at his hips, while reducing the bending at his lower back. That is why we recommend microstretching at the hamstrings during the workday. The best workplace technique is to sit, grasp your thigh, hold it up as you try to straighten at your knee. Try to hold this position for 30 seconds for each leg. At home, after work, it is even more effective that we do this lying on your back. We will discuss that in a later slide. Sitting can be very stressful to your lower back. It is a form of highly sustained, rather severe forward bending at the lower back, which loads your discs and increases the risk of disc degeneration. It also encourages weakening of your low back stabilizer muscles. We are often asked, what is the best chair for ergonomic health of your lower back? And the answer is, quite simply, placing the worker in an ergonomically perfect chair does not ergonomically create perfect posture. Posture control comes from the worker, not the chair. A highly adjustable chair helps a little, but here is the problem. Perfect posture, whatever that may be, is not good for you if you stay there for a prolonged period of time. Even great posture can be bad if you sustain that posture longer than an hour. because even in perfect posture, you will have gravity sitting on you. There will still be weight-bearing load on your discs and facet joints and prolonged loading of the ligaments. This loading blocks the blood supply to these tissues and risks pain and degeneration. What we really want and need is posture variety rather than posture perfection. For instance, you should change your seating every hour simply by raising the seat 2 inches, and then the next hour lowering the seat by 2 inches, just to change how the low back structures are being loaded. The more often you change the chair height, the more you are reducing the loads to various back structures. In a motor vehicle, simply change the seat adjustments often. Forward, backward, tilt, up, down, every few minutes. But the very best advice is to interrupt your sitting time often. Simply stand and do the standing back bend as we described earlier. This is probably the very best tactic for reversing low back stress that comes from sitting. Also, switching between sitting and standing often is an effective prevention strategy. An office desk can be fitted with an elevated platform that a computer can sit on. The platform is lowered for you to work sitting. After half an hour to an hour, you can pull a lever, raise that platform so you can work standing for a few minutes, and then later resume sitting again. So you are switching frequently between sitting and standing. Finally, take a walk. There are many, many health risks to sitting all day, way more than we have already described here, affecting the heart, the lungs, the circulation, your neck and arm issues, even brain activity. Anyone who sits for a living should try to take a short walk at every break time or lunch, and especially at home at the end of the day. Walking can reverse much of the damage of sitting. Then there is prolonged standing. This also contributes to fatigue and discomfort and excessive wear on the low back structures. You can minimize this with several simple tactics. Anti-fatigue floor mats, wearing good supportive shoes, anti-fatigue insoles, although these will need to be changed every few months, finding a footrest that allows you to change how you stand, switching frequently from left foot to the right foot to create standing posture variety. Many standing jobs can be done with the worker sitting occasionally on a tall stool, again to provide posture variety by switching frequently between standing and tall sitting. Finally, those who stand a lot can benefit from the seated forward bending stretch. Standing can cause increased loading to the facet joints. A seated bending stretch will unload those facet joints. We generally recommend this only for those who stand a lot, not for those who sit or bend a lot, because those folks already bend over too much already. This stretch is to unload the facet joints that often get too much loading during standing time. Simply sit on a chair and bend forward fully. Hold this for 10 seconds. Do this 3 times. We often recommend other micro stretches to fit certain demands on certain jobs. One example would be maintenance professionals who must get into very awkward positions, hold those positions for a long period of time while exerting themselves heavily to get the job done. These folks need a more comprehensive micro-stretching strategy. This would include stretching sideways for 10 seconds. It would also include a seated twist stretch. Twisting at the middle back is one of the things we lose as we get older. That risks joint sprains when a job requires twisting that you may not tolerate well. One example would be a forklift driver, bulldozer operator, farmers operating farm equipment. And this micro stretch is very easy to do. Simply sit, grasp the arms or back of the chair so that you can gently pull and hold your chest fully turned to one side. Keep your knees pointed straight ahead. Pull into a full twisted position and hold this 10 to 15 seconds. Alternate each way 2 to 3 times. Heel, arch, and ankle pain issues are common among those working on cement or steel floors. These problems often occur when the calf muscle gets tight, pulling up on the back of the heel bone, tilting it out of proper alignment in the foot. The micro stretch that addresses this goes this way. Stand about 4 feet from a wall. Place 1 foot behind you and 1 foot ahead of you, and lean forward onto your hands on the wall. Keep the back foot flat on the floor and pointed straight ahead. Lean forward onto your hands so as to bring your shin forward over the foot, stretching the calf. This is a powerful muscle that would need 30 seconds to adequately stretch. You have a rotator cuff at your hip. This can get tight with aging, or from standing and walking on cement or steel surfaces, or from sitting on vibrating equipment, such as a forklift. This rotator cuff, especially one muscle called the piriformis, can pinch your sciatic nerve or contribute to hip arthritis. It is often involved in hip and buttock pain. Stretching the piriformis, the rotator cuff of the hip, can help these issues. One important precaution, however, if you have had a hip replacement, don't even think about doing this stretch. It is performed this way. Start out sitting on a chair. Place your right heel on top of your left knee. Grab your right knee and pull it across your body toward your left shoulder. Turn your upper body toward your right. You are actually trying to bring your right knee toward your left shoulder. Hold this for 30 seconds, then do the other side. There are a few highly effective after-work recovery stretches you can do to stimulate good recovery from a hard day's work. The first of these is simply to lie on your belly, propped up on your forearms, so that your lower back is being gently, passively stretched backward. Simply relax in this position for 1 minute. This is important to recover from a day of prolonged sitting or a day of bending over or heavy lifting. Do not do this if it causes pain. If you encounter pain, check with your physical therapist for an alternative. Then turn onto your back and bend one knee up toward your chest, keeping the other leg flat on the surface. Hold this stretch for 30 seconds. Then do the other leg. If you have had a hip replacement or other hip surgery, do not do this one until you check with your physical therapist for alternatives. This is the safest, easiest, and most effective way to stretch your hamstrings. Lie flat on your back. Bend one leg up just enough to grasp your thigh above the knee. Hold your thigh here so that your hip is bent about a right angle. Keep your other leg flat on the surface. Holding your thigh here, now try to straighten that knee until you feel a pull at that hamstring in the back of that thigh. Let this stretch for 30 seconds, then do the other side. This is similar to the workplace hamstring stretch done in a chair, only better. Those are the 3 after-work flexibility stretches that we recommend to keep a healthy back healthy. There are also 2 low back strengthening and stabilization exercises. These are particularly important for those who spend the day sitting, which can over time seriously weaken those muscles. The first is the power bridge. Lie on your back with your legs bent and your feet resting on the surface. Lift your buttocks as shown in the first picture. Then hold your buttocks lifted as you reach one leg out straight. Hold this position for 3 seconds. Then keep your buttocks lifted as you switch leg positions. So you put the other leg out straight for 3 seconds. You are simply holding your buttocks lifted as you slowly march in place 10 to 15 paces. The other strength and stabilization exercise is the prone plank. Lie on your belly, propped up on your forearms like we discussed earlier. Except for this exercise, dig your toes into the surface and lift your body up onto your forearms and toes, as shown in the picture. Simply hold this position for as long as you can, with the goal of eventually being able to hold this plank position for 30 seconds.